Hello everybody, I'm Dr. Glenn Harrison and welcome to this week's episode of Why. This is where we take some of the most common health-related conditions and answer the why. Why is it happening? Why do I have this? Versus just you have it. You have the disorder, you have the disease. And there's always a mechanism for the why. So this week the question is, Dr. Harrison, why do I have elevated cholesterol? Why is my cholesterol up? And is there anything that can be done with it? Well, that's a big question. Our current medical system looks at cholesterol and it demonizes it. However, we need cholesterol. It's a building block for every aspect of life. We need cholesterol even for hormones. We cannot have proper hormones or any kind of hormone if we don't have cholesterol. So we need cholesterol. That's important. But there's two major types of cholesterol. One type of cholesterol is called HDL cholesterol. This is known as high density lipoprotein. My patients like to call it happy cholesterol because it's a good cholesterol. Think of it as a cleaning cholesterol in the body. And the other kind of cholesterol, and I'm generalizing for our session today to keep things tight, but the second type of cholesterol, or most common type of cholesterol, is called LDL cholesterol. This is low density lipoprotein, also known as, my patients like to call it, lousy cholesterol. So we have happy HDL and lousy LDL. LDL cholesterol, think of it as a big fluffy pillow. Okay, so that's the two types. And LDL cholesterol is actually a fix-it cholesterol. HDL is a cleaning cholesterol, and LDL, a way of explaining it, is a fix-it cholesterol. So the organ that makes both of these cholesterols, or all of the cholesterols, is the liver. And the liver, think of the liver, it's making HDL, and think of HDL as that marble. It's high density lipoprotein, and it sends these marbles through the arteries and through the heart, and then the HDL comes back to the liver, and the liver will make higher amounts of it in certain situations or lower amounts of it in other situations. But it's a cleaning cholesterol. But then the liver makes this big fluffy pillow, the LDL. The big fluffy pillow should go through circulation. There shouldn't be too much of it in circulation. But remember, it's a fix-it cholesterol. So if there's a bunch of injuries in the arteries, in your pipes, all throughout your body, your arteries in your heart, the marbles go by the injury or the bump on the inside of your artery, but the HDL, or I should say the LDL cholesterol, the big fluffy pillow, snags. So it doesn't bypass those bumps. It actually snags into them. And it is supposed to, because remember, it's a fix-it cholesterol. It's a fixing cholesterol. So if you have a lot of injuries in your arteries and your heart, the liver keeps making more and more and more of this cholesterol so it can fix all these injuries, and then you go in to do blood work. So then you go to do blood work, and then they see you have very high levels of LDL cholesterol, or the bad cholesterol. So then the solution is, give you heck and tell you to, eat better and get more exercise, and that's very vague, but that's usually the answers that I hear. And then you're given a statin medication, a cholesterol medication. Think of cholesterol medication, and by all means, it has its place. However, there's horrific side effects of cholesterol medications we don't have time to get into today. But think of cholesterol medication as a wine cork. This and your liver is the wine bottle. You put the cork into the bottle and the liver can't push out any more cholesterol. It still wants to because it knows there's injuries in the arteries that it's trying to fix. So that is the problem. That's one of the problems with our cholesterol approach, or the medical model's cholesterol approach. But what really causes cholesterol, or higher levels of LDL cholesterol, is inflammation. The inflammation in the body creating injuries all over our arteries. The inflammation can turn what we call systemic, globally all around our body, creating all these little injuries. And if you have all these little injuries, the liver's response is to naturally try to fix them with LDL cholesterol. So we do need cholesterol, the good and the bad, which really isn't the bad. But too high of levels of it is a great indicator of inflammation in the body. The beautiful thing is if you get inflammation down in the body, meaning fixing your body naturally fixing those arteries, your LDL goes down. So I look at LDL as an inflammatory marker, and sometimes an inflammatory process in your body can drive it fast, and sometimes it takes a long history of it to drive it up, but you can get past it. So I guess in summary, that hopefully that explains cholesterol and some of the causes of it, the major causes. Next day, I'll talk a little bit more about cholesterol and give you some of the causes of inflammation specific to cholesterol. So with that being said, I'm Dr. Glenn Harrison, and hope this was helpful. And I look forward to talking to you next day on the causes of cholesterol. Have a great day.